It said that a society is judged by how it treats its most vulnerable members. And at Christchurch Men's Prison, it would appear we are falling short. The latest prison inspectorate report has found inmates are waiting up to 3 weeks to be seen by a nurse, several months for a physio, and limited resources are having a significant impact on healthcare. Prisoner advocates say it's not limited to Christchurch, with jails across the country struggling under massive pressures. They're renewing calls for primary prisoner health to become the domain of the Ministry of Health, as they say corrections is not up to the task. Nita Blakeperson has more.
Christchurch Men's Prison is one of the country's largest, with capacity for more than 900 inmates. When the Inspectorate Office visited last June, it found that while prisoners were generally healthy and safe, access to healthcare was significantly impacted by insufficient nursing, medical officer and physiotherapy resources. On June the 19th, 2018, there were 157 health request forms which had not been dealt with. The oldest form had been lodged 3 weeks earlier. Prisoners referred to physiotherapists in April were still waiting to be seen in June, and the nurse's office, where medication is administered, was crowded and not fit for purpose. Cosmo Jeffrey, the Canterbury president of the Howard League for Penal Reform, says the prison system is under huge pressure.
Everywhere you look, the system is overloaded. And from the reports that we're talking about from the Inspector of Prisons, he basically declares that there should be at least 22 full-time equivalent staff people, and that's the minimum you need. So 22 full-time. At the moment, the way I look at it, they've only got 17. So that means 25% of the staff down.
Cosmo Jeffrey says retaining health staff has always been a challenge, and it's clear they're not coping.
I don't make a secret. I've been in prison. I know what it's like. And if you are not high on the list, then you won't get seen to. And it's the squeaky wheel gets the oil. So if you're a bit recalcitrant or a bit timid or you're not confident in your surroundings, you'll make one complaint and then you'll hope it gets better. And I know of cases where people have had brain issues and they keep getting paracetamols and find they have a tumour and they're rushed in at the last minute. And that's because the system is just totally overloaded.
Corrections Chief Custodial Officer Neil Beals says action has been taken to address the issues raised by the Inspectorate, with dedicated staff assigned to help coordinate medical appointments, and a recruitment process is underway for an assistant healthcare manager. A new health referral process has been brought in to improve appointment and recalls, which has seen a reduction in wait times. But the situation isn't confined to Christchurch. Ula Letele lost his niece Vicky to stomach cancer in 2017. She had entered the Auckland Region Women's Corrections Facility in 2016 with a diagnosis of irritable bowel syndrome and had died after a corrections doctor and nurse failed to respond appropriately to her symptoms.
If you were to look at this in the harsh light of day, it took her 6 months to get the attention that she required, and by which time it was too late. So as soon as Middlemore Hospital saw her, they found out that she had stomach cancer, needed to operate virtually immediately, and that was really only to give her, I think the prognosis at the time was maybe 6 months of life left.
Ula Letele says corrections apologised for his niece's care and made changes, but he says it's hard to change a whole system.
Unless the lessons learned at the Wiri Women's Facility is rolled out to the other facilities, correction facilities, then I'd imagine it'd be still virtually much the same. I mean, the nurses let them down, the guards let them down, and also some of the third-party service providers that were brought in to take care of her let her down.
Nigel Hampton QC is the patron of the Howard League for Penal Reform. He says prisons up and down the country are falling woefully short on healthcare standards. Mr Hampton, along with Ula Letele and Cosmo Jeffrey, all want primary prison healthcare handed over to the Ministry of Health.
By and large, the nursing staff see themselves as corrections officers and buy into the corrections philosophy and mentality, and I'm sad to say, see prisoners as second-class citizens deserving not of the proper attention, but rather second-class service.
Figures released to Checkpoint under the Official Information Act show that since October 2017, the Corrections Complaints Desk has received 332 complaints about health care. Since 2017, there have been 35 natural deaths behind bars and 2 compensation payments made in relation to healthcare in prisons. For Checkpoint, Corneta Blake-Person, TNA.